to VETChat. I'm Kathryn Bell, CEO of the Webinar Vet, and today we are bringing you the next episode in our Women's Health series, and I am delighted to be joined by Dr. Erin Greaves to discuss all things endometriosis. I'm really excited for this episode, but before we get started, let me introduce our guest today. Dr. Erin Greaves has an impressive background in developmental biology and reproductive health research. After completing a PhD in developmental biology at the University of Leeds, she pursued postdoctoral training at the Medical Research Council Human Reproductive Services Unit at the University of Edinburgh, working with Philippa Saunders. In 2015, she established her own laboratory at the MRC Centre for Reproductive Health at the University of Edinburgh, supported by an MRC Career Development Award Fellowship. Her research and contributions in the field continue to grow, and in 2019, she joined the University of Warwick as an assistant professor. So welcome to VETChat, Erin.
Hello, thanks for having me.
I'm so pleased to talk to you today. So at the Webinar Vet, we've been shining a light on women's health over the last 12 months or so, and it's become something that has been really well received with our community. So I'm delighted that we can continue these conversations today. And as I said at the start, we're going to be focusing specifically on endometriosis today. So to kick us off, could you explain to people who may not know what endometriosis is, please?
Yes, of course. So, endometriosis is when tissue like the lining of the uterus, the endometrium, grows outside of the uterus. So, that's within the pelvic cavity, usually on the lining of the abdominal wall, but also it can grow on the lining of organs within the pelvic cavity. And these tissue growths are called lesions. And the lesions grow and develop, and they can cause chronic debilitating pelvic pain, but they're also associated with infertility as well.
Okay, brilliant. And is it quite common, endometriosis?
Yeah, it's so common. So it impacts about 190 million women worldwide.
Wow.
It's actually as common as diabetes. It's crazy because even though it impacts the same amount of people,
Mm-hmm.
there's only about 20 as what we call assets in the pipeline. So these are potential new therapies that are being explored. But for example, with diabetes, there are 580. So there's this huge gap really in like trying to find new things that would be good therapies for women with endometriosis.
Yeah, absolutely. Do you think it is still underdiagnosed and misunderstood?
It is underdiagnosed. Actually, I was watching a presentation the other day and it was presenting some results from a recent McKinsey report. And it actually said that 6 out of 10 women that have endometriosis are actually undiagnosed. So women might think that they have endometriosis, but they haven't yet received that definitive diagnosis.
Mm-hmm. Why do you think that is?
Some of the main reasons are because the symptoms are quite non-specific. So generalized pelvic pain that can happen during the time of your menstrual period, but also outside of that as well, is just it's not really a specific symptom. It can be linked with other things as well. And often women that have endometriosis will also have symptoms that sound a bit like irritable bowel syndrome as well. So there's this the non-specific nature of the symptoms, but also women's pain historically is normalized.
Mm-hmm.
And like the first few times a woman goes to a doctor, sometimes they can just be told, oh, it's just part of being a woman, it's just a bad period.
Mm-hmm.
Endometriosis isn't just a bad period. It shouldn't be normalized. And if you're experiencing pain that means that you can't go about your daily activities, that's not normal.
Mm-hmm.
And I think there's a lot of work to be done about increasing awareness of norms and non-norms of
Mm-hmm.
menstruation so that women can recognize, but also be heard when they are saying that the pain that they're experiencing is not normal. So yeah, lots of work to do around awareness within primary care, like symptoms can be dismissed sometimes. And, sometimes the first time a woman goes to the doctor with these kind of symptoms, they're put on hormonal contraception,
Mm.
and that might curb some of the symptoms for a while. And then, of course, if they decide to stop those contraceptives at any point, then the symptoms, of course, will come back.
Yeah. Okay, thank you. So if somebody, some of our listeners who are listening now, if you mentioned just then, if you aren't able to kind of carry out your sort of normal daily activities, is that when really they should go and seek advice and go and see a doctor and, sort of understand that this isn't normal?
Yeah, I think you can be like really direct with your practitioner and
Yeah.
say you want to be referred to an endometriosis specialist.
Hmm.
And sometimes having that directness does help, because then I guess it makes a practitioner realize that actually you've done your research.
Yeah.
Actually, there's a really nice tool that has just been launched. I think it was yesterday, on the Wellbeing of Women website, and it's a menstrual or period symptom checker. And it's like a
Okay.
survey where you can just fill in your symptoms, and it will tell you whether what you're experiencing is normal or not normal. And that's kind of like a little bit of evidence that you can take with you when you go and see your GP. But also, just keeping a symptom diary is also really useful as well.
Yeah. Okay, fantastic. Just to recap then, what would you say some of the common symptoms are? I know you touched upon like severe kind of pelvic pain. What other things should we be looking out for?
Yeah, chronic pelvic pain, pain during sex, pain when you go to the toilet as well, particularly so at the same time as when you're menstruating. Fatigue also comes hand in hand with endometriosis as well sometimes. And then if you're also having issues trying to conceive, if you are trying to get pregnant, all of those kind of add up to a potential diagnosis.
Okay. So just on fertility, how does endometriosis affect fertility? What sort of options are there out there?
Yeah, so it's thought that between 30 to 50% of women with endometriosis might have infertility or subfertility. It's definitely the more severe stages of
Mm.
endometriosis that impact fertility the most. Many women that have got mild endometriosis will be able to conceive fine with no problems whatsoever. It's just tricky because, of course, the first line of management is hormonal therapy. And of
Yeah.
course that is contraceptive, so it's not ideal. But yeah, if you're wanting to conceive and you're having issues, your specialist will most likely refer you for a laparoscopy. And often women that have severe endometriosis, if they do have those surgeries to remove the lesions, that often really helps their fertility, and they're then able to conceive within the 2 years after they've had the lesions removed.
Okay. Brilliant. That's so interesting.
Yeah, I mean, one of the key issues is with the laparoscopies. That's the keyhole surgery that women undergo initially to get a diagnosis, but also to have the lesions removed as well. You can get recurrence after the surgery, so it's thought that within 5 years, about 50% of women will have recurrence of symptoms. So that sometimes they do need to have additional surgeries.
Mm. Okay. And that must be so tough, I guess, for people going through this. Just to sort of touch upon like the impact that women face who are going through endometriosis, especially women in veterinary medicine. What sort of things can people struggle with if they have endometriosis?
Yeah, I guess the pain and the fatigue can really impact how well you perform at work. So I guess trying to get a good kind of management strategy in place is beneficial, and of course you can work with your GP if you've got good GP service to try and get a good pain management strategy going, but also kind of thinking about ergonomic considerations as well. Like, are you working comfortably with benches and stools, things like that at a right height? And kind of like access to heat pads as well can really help
Yeah.
if you're really having like like a flare or a really painful time.
Okay, brilliant. Yeah, because I've worked with somebody before who's had endometriosis and struggled with it, but it was during the pandemic, and we were very much 100% working remotely. And she was able to have like hot water bottles and be at home, and
Hmm.
it's just very different, isn't it, to being kind of somebody who's like in a veterinary team in practice who obviously doesn't have that option. But I guess, as you say, like even if small adjustments can be made, it can make a big difference.
Yeah, I think even having like a comfy chair that you can go and sit down on in between like
Yeah,
surgeries, or yeah, like just having the ability to have like a nice rest spot that's comfortable where you can take a break would be
yeah.
like really helpful.
And I guess from a sort of communication perspective as well, would you have any advice for how people, could discuss these things with their teams, with
Hmm.
their managers? Because I guess it depends on the type of relationship that you've got with your team, but communication is really key, isn't it, with these sorts of things?
Yeah, I think just being very open about the symptoms that you're experiencing. If you have got a diagnosis, tell them that it's endometriosis. If you're still not sure, you just explain the symptoms, that you're experiencing pain that sometimes really impacts your ability. And, encouraging your employer to sign up for an endometriosis friendly employer status. So
Mhm.
if you look on the Endometriosis UK website, they have this scheme that employers can sign up to, and there's lots of really useful information for employers there about destigmatizing these symptoms and having like a language within the company where people can talk about periods, pain that they're experiencing. There's also policy that can be looked at as well within different companies, allowing for like menstrual leave policy is becoming more popular now,
Brilliant.
and flexible working during like flare up periods.
Okay, fantastic. We're actually at the Webinar Vet, we are launching for International Women's Day a veterinary wellness hub.
Hmm.
So we'll definitely get all the links that we can off you for all these great things that you're recommending, and we'll put them all there so that our community can go back and hopefully find them quite
Hmm.
easily, which would
Excellent.
be great. So you're doing obviously a lot of research at the
Mhm.
moment. Can you tell us a little bit about that? Is there any sort of promising developments that are happening?
Yeah, so my lab group focuses on the role of the immune system in endometriosis, and what happens there in terms of cells that actually become modified because of the condition.
Hmm.
And we are particularly interested in cells called macrophages and their precursors, which are called monocytes. And these macrophages in endometriosis, they act in a way that supports the development of the endometriosis lesions. So these cells like encourage the growth of new blood vessels within endometriosis lesions, but also nerve fibers. And they also play a role in activating the nerve fibers to cause pain. And we've done lots of work trying to figure out how they become modified by the disease. And the great thing about macrophages is that you can change them, how they function. And we've been able to identify a compound that's currently in clinical trials for oncology that changes how macrophages function. So that instead of promoting disease, they act to start resolving the ectopic tissue that's present.
Oh, well.
And we've done lots of testing, and it looks like it's really has a positive impact in our preclinical models. So we're now taking that into clinical trials for women with endometriosis. So I mean, that's our main focus, is trying to find non-hormonal therapies, and we really think that immunotherapy is the way forward. Currently, it looks like this potential therapy that we've identified doesn't have any impact on fertility either.
Oh, wow.
So really, really positive. But these cells are so central to the disease mechanisms that we also think that we might be able to use them for diagnostic tests as well. So the precursors are in blood, and we're doing lots of work at the moment looking at identifying biomarkers, because that's the other thing about diagnosis, is that there is currently no non-invasive biomarkers. but we have identified a signature. And we're just in like the validation phase of that, and then trying to figure out how we make that into like a point of care test in
Mhm.
the future. So still a way off, but we're
Mhm.
doing lots of work, to try and improve both diagnosis and therapy for women with
Wow.
endometriosis.
Yeah, that sounds incredible. And what would like the end goal be? What is kind of like your hopes for the future with it all?
Yeah, so I really think that immunotherapy is the way forward, but endometriosis is so different in every woman. Like,
Mm.
the symptoms don't correlate with the severity of the disease, and each woman experiences it very differently. And we think that that might be because there are different responses going on with the immune system. So I'd really like to be able to say that in the future we'd have like a precision medicine approach where we know exactly what is going on with the immune system of that woman, and be able to tailor the treatment accordingly depending on what the response is.
Mm-hmm. Yeah, fantastic. And I guess, do you think there is enough like research that's going on in general around endometriosis, or do you think there's much more that could be done?
Well, we absolutely need more research done on it.
That was a
Um,
silly question.
yeah, I mean, there just isn't that kind of, critical mass working in it. And I guess that's why it hasn't progressed at the same rate as other fields because,
Yeah.
you know, for example, cancer and other things that impact men and women at the same rate. There's so much more funding available.
Yeah.
It's just bad that, well, really bad that disorders that impact only women have historically been so underfunded. But I think those that work in the endometriosis field are really learning from other fields now and trying to take more of a interdisciplinary approach, like kind of taking knowledge from other people that they know in other fields and starting to apply that. And I think research has really advanced in the last 5 years or so, and hopefully that's just going to be exponential now.
Yeah, absolutely. That would be brilliant. So we're just getting close to time, but I just wanted to ask you, what piece of advice would you give to women in veterinary medicine who are currently managing endometriosis?
Yeah, I think having a really good support network and of people that you can talk to about what's going on, so that when you are having a flare up or a really bad day, that you've got people that you can talk to that are gonna root for you and
Mhm.
help and make sure you've got the things that are going to make you feel comfortable, and just trying to have a good dialogue with your line manager as well, so that you can talk about ways together where you can like manage workload during difficult periods. But yeah, and absolutely strive for that referral to an endometriosis specialist, and sometimes that can mean being a bit more assertive than you might want to be when you go to your GP surgery.
Yeah, absolutely. It's so important, isn't it, to advocate for yourself?
Absolutely.
Yeah. Okay, fantastic. Oh, well, is there anything else that you want to share with our listeners about endometriosis that we might not have touched upon in the conversation?
No, I don't think so. Thank you very much for having me on the podcast. It's been
Oh,
great.
no. Thank you so much for joining us. It's been fascinating, and best of luck with all the research and everything that comes from that as well. And as we mentioned, we would love to add any information that you've got and that you've referred to during the podcast to our veterinary wellness hub. So we'll make sure that we put everything there.
Great.
Okay,
Thank you.
wonderful. Oh, well, thanks, Erin. Take care. Thanks for joining us.
Bye.
Bye.